Hello, my name is David Banjo. In this short video, I'm going to be demonstrating preparation of medication and injection. And to start with, I have here printed document, which is the physician order and medication record. I'm going to be comparing the two in order to validate the six right, which is the right to patient, right to medication, right to dose, right to time, right to route, and right to documentation. So in the physician order, the first thing to look for is the name of the patient, and to confirm it in the medication record, Buzajab is rightly stated, Buzajab. MRN 8713461 correctly stated, 8713461. Date of birth 06/20/1975. Allen Long being the physician. Then the date ---- 2020 time 7 a.m. The first medication here says ceftriaxone 1 gram IMQ12 for infection, reconstituted in 2.5 ml sterile water at 7 a.m. The second medication says the date ---- 2020 7 a.m. PPD 0.1 ml ID today, read in 48 to 72 hours, rightly stated in the medication record. PPD 0.1 ml ID today, read in 48 to 72 hours at 7 a.m. And the third medication says date ---- 2020 7 a.m. NPH insulin 12 units sub-Q before breakfast, sliding scale regular insulin sub-Q A, C, and HC. In the medication record, NPH insulin 12 units sub-Q before breakfast, 7 a.m. sliding scale regular insulin sub-Q A, C, and HC. So from what I have in the medication record, comparing that with the physician order, I can see it's a valid information and it's correctly stated. It says on the physician order no known allergies, and on the medication record no known allergies. So for the patient Buzajab, her glucose level is 389. So that connotes she is falling in the blood sugar group of 351 to 400, and the regular insulin dosage is going to be 12 units, and that means Ms. Buzajab is going to be taking 12 units of insulin dosage. So I have it stated in a order that she's going to take 12 units sub-Q before insulin before breakfast. So I've been able to affirm that what I have in the medication record is correct with what the physician has ordered. So I put that aside. So in this video, I'm going to be performing 3 checks. And to start with, my first check, I'm going to perform hand hygiene and I'll put on a new glove. So I'm going to be going into the cart and pull out my medication using the medication record. To start with that now, our first medication is ceftriaxone. I'll look into the drawer. I'll pull my ceftriaxone 1 gram. This is the right dosage. Here I have ceftriaxone for injection, USP 1 gram. Here is the right dosage. I don't need any dosage calculation for this one, and I don't need any measurement. Here is the right dosage. It said reconstitute in 2.5 ml sterile water, so I'm going to get my sterile water from the drawer. Here is my sterile water. I'm going to sit down, set that aside by its side. So to administer that, I'm going to need the 3 ml syringe with needles. So I'm going to look for the 3 ml syringe. Right here, I have the 3 ml syringe. I'm going to put it aside, then couple with 2 needles. I'm going to be putting the 2 needles by its side. So here is my 2 needles by the side. So I'll go to the next medication. Is PPD 0.1 ml today, reading 48 to 72 hours. For the PPD, I don't have any PPD here. I'm going to pretend here is my PPD for today. For the sake of this video, I'll put it here. Then I'm going to be administering that using the tuberculin syringe. So I'll put the tuberculin syringe right here. Then the next thing I'll do is the third medication, which is NPH insulin. From the drawer, I'll pull it out. I'll look for the NPH insulin. Here's my NPH insulin. So NPH insulin, sorry. Here's my NPH insulin. I'm going to see that here, and it says sliding scale regular insulin. Here is my regular insulin. I'm going to sit that right here. So I've been able to see that I have the right dosage of the right medication pulled out from the cart. And to administer my insulin, I'm going to be using the insulin syringe. So I have the insulin syringe right here. I have the PPD and I have the ceftriaxone. So the ceftriaxone I will confirm again. Ceftriaxone 1 gram, sterile water, needle and syringe right here. The PPD and the tuberculin syringe right here. NPH and regular insulin with insulin syringe right here. So these are the 3 medications according to what I have in the medication record. Then I have my ampoule here, which I'm going to demonstrate last in this short video. So from what I have here, I've been able to pull out my medication, and I'll be completing that using the drug reference book. Going into the drug reference book, for the first medication is ceftriaxone in the class of ceftriaxone. It says for an adult, you have to administer 1 to 2 gram day. So I have here ceftriaxone 1 gram high hem, kill 12 hours for injection. So it means the patient has the right dosage, since the dosage here says between 1 to 2 gram on daily basis, and she has 1 gram to be administered for 12 hours. So which is okay. Then what is the action of the ceftriaxone? It inhibits bacterial cell wall synthesis. And what are the side effects, the things to watch out for after administering the ceftriaxone? Headache, dizziness, and seizure. Those are the things to really watch out for in ceftriaxone after administering that. Then for the PPD, he said after administering it, you have to read in between 48 to 42 hours. So that is for the PPD. You have to read that in 48 to 72 hours. So, and he says we should just administer 0.1 ml for today. Then for the insulin, it says for regular insulin, you should administer between 30 minutes to 1 hour before meal. And the instruction says here NPH insulin 12 units sub-Q before breakfast, which means it's the right dosage. So if the patient has any meal, I'm going to ask them to set it aside until I have administered the insulin. So, and it says for an individual is depends on an individual between 7 to 12. Like I gave the unit Buzajak is going to be taking for it depends on an individual. For her, because her glucose level is 389, so she falls in the blood sugar group of 351 to 400, so she's going to be taking 12 units. And from what I have here, it says for an individual between 7 to 12, which is the right dosage for her. So for the side effects, it says we should look for blood vision and dry mouth. So those are the things I will watch out for when I administer the insulin. And the action is to decrease blood glucose. So I've been able to confirm and complete my first check. I will now be proceeding to my second check by performing hand hygiene and put on a new glove. So to start my second check, I'm going to be preparing the medication before I can administer it. So the first thing I'll start with is my looking at the record again. I have ceftriaxone 1 gram, put it aside. I have the sterile water, which I'm going to set aside. Then one thing I'll do is I'll take off the cap, and I'll have an alcohol pad to clean the top of the valve. So I've been able to wipe the top of the valve. So, and the next thing is I'm going to prepare my syringe. I'll open the syringe. Then I'm going to fix a needle. I'm going to fix a needle. So I'm going to set this down. So I'm going to put my sterile water right here. Then I'll take off the cap of the needle. Then I'm going to draw here of 2.5 ml here into the syringe. I'm going to draw 2.5 ml into the syringe. There you go. I've been able to draw 2.5 ml of air into the syringe. So I'm going to hold the syringe this way and drop the air into the sterile water. And immediately I'm going to draw 2.5 ml of sterile water. I'm going to draw 2.5 ml of sterile water. There you go. I have 2.5 ml of stirring water. So I'm going to set this aside. So the 2.5 ml of stirring water I have, I'm going to drop the hair into the ceftriaxone. I'm going to drop the water, into the ceftriaxone. So I've been able to drop the water into the ceftriaxone. I'll take off my needle and I'm going to provide safety by recapping using the scooping method. I'll recap the needle using the scooping method. So the next thing I'll do is I'm going to mix my powder evenly with the stirring water. The instruction says do not shake, and I'm not going to shake it. I'm just going to make sure I rub it in my home palm. I'll rub it in order for me to ensure that the powder is evenly mixed with the stirring water. So I've been able to mix it. I've been able to see that it's mixed evenly. So I'm going to sit the ceftriaxone down on the table. Then I'll go again and get my syringe. I'll remove the cap. Then I'm going to draw air of 2.5. I'm going to draw air of 2.5 into the syringe again. This way. Okay. So I'm going to drop the hair right into the ceftriaxone. So I'm going to draw 1 gram of the ceftriaxone. I'm going to be drawing the 1 gram of the ceftriaxone because that is the required dosage I need to administer to my patient. I've been able to draw the entire 1 gram of ceftriaxone. I've been able to draw the 1 gram of the ceftriaxone. I'm going to sit the valve on the cat. Then the next thing I'm going to do is I'm going to be removing the needle. I'm going to be removing this needle and I'll put another needle. I'll drop this in the sharp object container. So I'm going to fix a new needle. So I'm going to set this aside. So I've been able to draw that. The next thing is to draw my PPD. So for the PPD, here's my PPD. I'm going to get another alcohol pad. I'm going to get another alcohol pad and I'm going to wipe. I'm going to put this in trash. So, and I'll get my PPD syringe. I'm actually going to draw from here. So just show us what I'm going to do. I'll take off the cap. I'll draw 0.1 ml of air. 0.1 ml of air into the syringe. So I'm going to drop the hair into the PPD. So I'm going to draw 0.1 ml of. So I've been able to draw 0.1 ml of PPD. So I'm going to set that aside, and I'm going to provide safety by using scoop method again. I'm going to provide safety by using the scoop method. Then the third medication, which is my insulin, I'm going to set that aside. I will have taken off the cap again. Then I'll wipe. Then I'm going to open my syringe. Then I'll take off the cap. I'm going to draw 12 ml of air into my syringe. This way, 12 ml of air. I'm going to drop the air into the NPH. So I'll bring out my needle. Again, I'm drawing another 12 ml of air. I'm going to drop the hair again into the regular insulin. So then I'm going to drop 12 ml of regular insulin. 1, 2. Okay, I've been able to draw 12 ml of regular insulin. So I'm going to show a nurse, a registered nurse. Then I'll come again to the NPH. I'm going to draw another 12 ml. So I'm going to draw 12 ml. Making 24 altogether. So I've been able to draw 24 ml of insulin. I'm going to show you now. Then I'll now go and provide safety again by using the scooping method. I'll recap. Then I've been able to prepare my medication. I'll set all these ones aside. Now I've been able to prepare my medication. I have the ceftriaxone, I have the PPD, and I have the insulin, which I've been able to prepare. So I have the 3 right here. So I'm going to be going to the patient's room. So after performing the second check, I'm going to take off my hand glove, perform hand hygiene, and I'm going to the patient's room. Hello, Miss Jack. How are you? Can you please confirm your first and last name for me? Okay, Buza Jack. Your date of birth? Good. Anyway, my name is Temitope Shebanjo. I'm a nursing student from Mountain View College. I'm here to administer your medication today. But before doing that, allow one moment, please. I've been able to introduce myself to her and I'll be able to verify her, but I'll have to verify the medication I brought in first before administering. So I have my ceftriaxone, 1 gram, already prepared. I have my PPD 0.1 ml right here, and I have my insulin here, 24 ml altogether, regular and NPH. So I've been able to confirm I have the 3 medications, which is the right medication for the patient. Okay, Miss Jack. Oh, okay, allow me to adjust your bed before we can administer your medication. I'll provide safety, then I'll perform hand hygiene again. I'll put on a new glove. So Miss Jack, I'm ready to administer your medication. I'll get a alcohol pad. I'll allow it to air dry. I'll put this in trash. Then I'm going to start administering medication from the most from the least painful to the most painful. And in case of the insulin, I'm going to administer it immediately, 5 minutes immediately after preparation. That is why it is the last medication I prepare. So I'm going to start by administering my PPD, which is in the group of intradermal injection. And to do that, I'll be going to the forearm anterior, above the wrist, in the lower arm. I'll be going to the midway area. So I'll be ensuring that I go 5 to 15 degrees into the skin, and I'll be administering the medication perpendicularly. So for the PPD, I'm going to take off the cap. I've already cleaned the residual area, so I'm going to go straight this way to the arm, and I'm going to administer perpendicularly. So I've been able to administer the PPD. Then I'll drop this into the sharp object container. Then the next medication I'll be administering is going to be the insulin, which is a subcutaneous injection. To do that, I'll allow my patient to choose which part she wants. But for today, this patient has chosen the stomach, and I'm going to be moving 2 inches away from the umbilicus. I'll be going 45 degrees into the skin in order to administer that. So and I'll go ahead and take off the cap. I'll wipe again, put this in trash. Then I'm going to pinch straight and insert it into the stomach, then administer. And I'll drop this into the sharp object container. Then for the third medication, which is intramuscular, the ceftriaxone injection. So I'm going to be doing that by going to the vastus lateralis. So I'll be pulling part of the patient's skin. I'll use my hand to pull part of the patient's skin. After administration, I'll leave the other part to cover. But then I'll be going 90 degrees into the skin. For that one, I'll take my alcohol pad again. I'm going to wipe to allow it to air dry. So I'll take off the cap. Then, since I'm going 90 degrees in the Z-track direction, so I'll go this way into the patient, and I'll be able to administer my medication. I already used my hand to hold the skin, so I'll drop this in the sharp object container. So I'll leave this part now. I'll allow the skin to cover it. So I've been able to administer that. Then I'll now use the alcohol pad again to clean. I'll assume I have alcohol pad, and I'll use that to clean. So I've been able to clean that. So I've been able to administer the 3 medications I have. Then the last thing I'll do here is I'm going to lower the bed and make sure the patient is comfortable, and I'm going to perform hand hygiene. So I'll perform hand hygiene. I'll make sure the patient is good. Then I'm going to demonstrate for my ampoule. For my ampoule, I'm going to use the alcohol pad. I'll open alcohol pad. I'll use that to hold the tip of the ampoule, and I'll take it away from me and from my patient. Then I'll go this way. I'll break it, and I'll drop it, the broken part, into the trash, into the glass object, sharp object container box. Then I'll drop that one. Once I drop it, I'm going to be using the filtered needle, because there may be some particles in it. So it's the filtered needle I'm going to use to do that.